ASCO 2020 has been an exciting meeting for the field of colorectal cancer. Three major studies have been presented, namely the phase 3 KEYNOTE-177 study, in which pembrolizumab was compared with chemotherapy in patients with microsatellite instability high, mismatched repair deficient metastatic colorectal cancer as first-line treatment. Then a phase 2 study for patients with HER2 colorectal cancer with the trastuzumab deruxtecan have been also announced as part of the DESTINY CRC01 study. And finally, the updated results of BEACON CRC for the subset of colorectal patients with BRAF V600E metastatic colorectal cancer. In the plenary session of ASCO 2020, the results of KEYNOTE-177 study were presented. In this study, 153 patients previously untreated with performance status of 0 or 1 with MSI-high, microsatellite instability high, or MMR, mismatch repair deficient disease were randomized between pembrolizumab and investigator choice of chemotherapy. In this group, there were 154 patients. Crossover was allowed between chemotherapy group and pembrolizumab if the disease was progressing. Primary endpoint was progression-free survival and overall survival, and in this meeting, the PFS results have been presented. It was exciting to see that patients on the pembrolizumab arm had the 16.5 months PFS as compared to 8.2 in the chemotherapy arm. This was statistically significant with a hazard ratio of 0.6. It's worth mentioning, though, that there was a subset of patients who crossed over at 6 months, and this may indicate some innate resistance to immunotherapy. The anti-tumor response was higher in the pembrolizumab arm, with almost 44% of the patients responding to the treatment as compared to 33% on the chemotherapy arm. And this is less from what would be expected in first-line treatment, but not something that cannot be explained, as patients with this phenotype might not be as chemosensitive as the rest of the colorectal cancer patients. Interestingly, the progressive disease was noticed in almost 30% of the cases at the first imaging assessment as compared to 12% in the chemotherapy group. Also, the forest plot identified two groups that may not respond as well to immunotherapy, namely the KRAS and RAS mutant patients, as well as the performance status 1 patients, and this will need to be followed in subsequent reports. Chemotherapy obviously caused more side effects as compared to pembrolizumab, 66% over as compared to 22% with pembrolizumab, and pembrolizumab would cause more immunotherapy-related events, but obviously the numerical difference was not that significant. Noticeable also is that there was almost 1/3 of the patients crossing over from the chemotherapy arm to the pembrolizumab arm, which might have an impact on the overall survival data, which will be presented later on. This is a practice-changing presentation in the sense that pembrolizumab will be used as a first-line treatment for patients with MSI-high disease, but similarly, we cannot ignore the fact that there will be a subset of patients who will not respond and will need biomarker analysis to identify that subgroup. The immunotherapy has a significant role in the management of colorectal cancer from now on, and further announcements on adjuvant and neoadjuvant setting will be awaited. During ASCO 2020, the DESTINY CRC01 study was presented. This is a phase 2 multicenter open-label study of trastuzumab deruxtecan, which is antibody-drug conjugate composed of anti-HER2 antibody cleavable tetrapeptide-based linker and topoisomerase 1 inhibitor with a high antibody-to-drug ratio. In this study, patients with unresectable metastatic colorectal cancer, HER2-positive disease, and RAS BRAF wild type with who had received more than 2 prior lines of chemotherapy were included. 53 patients were included in cohort A, which is the main cohort of the study. In this cohort, patients had immunohistochemistry 3+ or immunohistochemistry 2+, and in situ hybridization plus disease. The primary endpoint was the overall response rate. After a median treatment duration of 4.8 months, the response rate in this cohort was 45.3%, which is impressive result in this kind of advanced and refractory setting. The overall response in patients with previous anti-HER treatment was equally high at 43.8%, and this should be kept in mind. The progression-free survival was 6.9 months, and the median overall survival was not reached. It is also interesting to notice that between the two subgroups, mainly immunohistochemistry 3+ patients got the response as compared to the immunohistochemistry plus to ICH plus. And this should be followed in the future, considering the selection of patients to be treated with this drug. Another factor also to comment on is the interstitial lung disease, which is a drug-specific related event. And obviously, there were 2 toxic deaths from this medication. There were 6.4 patients presenting with this adverse event, which is lower from what has been noticed in the breast cancer patients, and might be a dose-related effect. So this drug will be added in the armamentarium of the colorectal cancer for HER2-expressing tumors, but further investigation with a potential randomized trial will be expected to exactly identify its role in the management of colorectal cancer patients. During ASCO 2020, the updated results of BEACON CRC study were presented, in which 6 more months of additional follow-up were included in the analysis. As we already know, the BRAF V600E colorectal cancer patients don't fare well on chemotherapy, and optimal treatment has been for a long time been tried to be identified. In that sense, the BEACON CRC study randomized patients between encorafenib, binimetinib, and cetuximab, encorafenib, cetuximab, or cetuximab, or irinotecan cetuximab as the standard arm. The initial report showed that the combination with the triple regime gave better survival, but this updated presentation now suggests that the doublet as well as the triplet have similar survival of 9.3 months, statistically better than the chemotherapy arm, with a hazard ratio of 0.6. The positive also point in the study is that the side effects from the doublet combination is much lower than the triplet regimen or the chemotherapy arm. And in that sense, the doublet encorafenib cetuximab will be the standard of care for the poor prognostic group of BRAF mutant colorectal cancer patients. Results on earlier lines of treatment, especially first line, are now awaited to find better ways to treat this kind of colorectal cancer patients.